I've always believed that good dentistry isn't about speed. It's about precision.
When Anand's doing his thing, when he's in his room, he's in his element. He's doing what he loves and he's precision and he's focused. You can't distract him from that.
Building things is my waking meditation. And it makes me a better dentist. What we're going to do tomorrow, Hales, is we've got the sinuses here. We're just going to pop one implant, 2, 3, 4.
A good dentist is someone who can do the technical stuff, but they can also teach it and they can also explain it to patients as well so they understand it. So with Anand, he teaches our team how to be a good dentist, but a good dentist is just not those technical skills. It's how he communicates, it's how he gets them to understand so they can see exactly why he's doing what he's doing.
And so we just need to be careful of the sinus up here.
Now, have you seen us before? Do you have a file with us? Yeah.
Beautiful. Stay.
Yeah,
Sit.
yeah.
Bruce, say hi. Good boy.
Belinda and I love dogs. Oh, look at this. Who's this? It's Brucey Dog. We know there's a strong tradition of using dogs to help reduce anxiety for people and patients, in the medical setting, but also, other therapies as well. So we thought, well, why not just combine our two passions of, one, making things more comfortable for nervous people and our love of dogs. And that's when we introduced Dog to Bruce.
Alrighty, in you go, Bruce.
So the therapy dogs was a small idea that we really wanted to try to see what happened, but now it's part of who Warragul Dental Care is. People book in to see the dogs before they book in to see the dentist, and that's just beautiful. They're part of who we are now.
Hello, buddy. Hello, big voice. Hello, Brucey. Hello, sweetheart. How are you, sweetie? Good job. There's a lot of people that find going to the dentist very stressful and have a lot of caution about going and not being happy to go. So having a dog in there that can help them relax and calm down during a dental procedure, especially children, that actually can change their perception from not wanting to go to actually asking to actually go and see the dog and interact with the dog during their procedure.
Before we introduced Dog to Bruce, we did a lot of research into how do we do this. And the trouble was there was nothing in the dental space. We contacted the Australian Dental Association, all sorts of people, and there were no guidelines. So we had to develop and create the guidelines for therapy dogs in Australia in the dental environment.
It was very risky and it was a gamble, and he did a magnificent job to follow through and work on that for 1.5 years before the dog was even allowed to go into the dental clinic and work with children.
So about 10 years ago, I decided for a career change, and dental had always fascinated me, trying to help people make a difference in an area that a lot of people don't find super comfortable. I started off at a different practice and then saw that Warragul Dental Care had just got a therapy dog and I had to be part of the action, so I jumped ship and joined the team. It was all about the dog. Dr. Bruce won me over. Belinda and Anand were a perk, but Dr. Bruce sealed the deal.
The long-term impacts that this can have, and how they've, by introducing Dr. Bruce, have changed people's approach and willingness to go to the dentist.
Bruce has to have a robust temperament to be around all the noises that happen, the drills, the suction, all those things that happen in a dental clinic. He also has to be calm when other people are a little bit anxious, a little bit cautious, sometimes very upset. He needs to be able to interact with those people, so he has to have a sense of empathy and work with those people to be able to stay calm and keep them relaxed.
I wanted to be the therapy dog trainer because it was my passion and I like to do things to perfection. And the only way I could then train someone else is that I want to do it myself and learn from my own mistakes, but also see the value that it brings. And I still go in now and do the dog stuff when I want to. I can't explain to you the joy it brings when you see someone transformed by just having an experience with Dave. But doing it myself has allowed me to see the value and beauty of what he can do and how he can change somebody's experience. And it's amazing.
Which one is it? Which one is it? This one? Good boy!
A few years ago in COVID, Dave joined the team. We're all very excited to get a second therapy dog, especially Dr. Anand. Dave has since taken over the reins and being the therapy dog here, and Bruce has since retired. And Dave is absolutely made for being a therapy dog. He just loves it. Bruce, he came in and changed people's lives, and now it's time to go home and hide all the socks and hide all the pens and live his best life.
Dr. Bruce was the first certified dental therapy dog in Australia. We're really proud of that. He's an amazing dog. All our patients love him, whether you're nervous or not. I mean, how can you not love a dog? Especially a Labrador, because they're the best.
Ta-da, big boy. Okay, ta-da, big boy. Thanks very much, mate.
Cheers, mate.
You take
Catch
care.
ya.
Cheers.
My parents had a corner shop, which is what most Indian families did back in the 1980s, back in England. And it was actually quite good fun because it was just so different from, you know, all the other kids growing up. Literally was a kid in a sweet shop. It was hilarious.
When I was expecting Anand, I said to my husband, the only thing is, I don't want to leave him with a childminder or anywhere else. I want to be their full-time mom. So the only way we could do was we bought this corner shop. So I was running the shop, looking after Anand as well. And my husband used to go out to work. He was only 17, when his father passed. I think, it was a shock to both of us. But that made him grow up more or less overnight. He went very quiet for a while. He wouldn't sort of take out his emotions on anything, or he wouldn't say anything to anybody. That is how it affected him. We got Goldie from a rescue center, actually. From the moment that we got him, he loved it. And I think, the bond that he had with the dog, it was really, really good because, if the dog is around and if I even raise my hand to Nand, the dog will come for me because he was so protective of Anand.
Back in the UK, I started working in the NHS, which is what every UK dentist does, and that's the public system back in the UK, which is fine, but it's a very conveyor belt style of dentistry. It's very mechanical. We don't really have time to think about the person behind the teeth. And that really wasn't the way that I wanted to practice dentistry. For me, it's about building connections with people, and it's about treating the patient. The teeth is almost an after effect. The teeth is the mechanism through which I treat the patient. I had some friends who were in Australia, and after talking to them, this seemed like somewhere where I could practice dentistry in the way that I wanted to. So I made the decision to leave the UK, pack up my bags and fly over to Oz. And that was 11 years ago, and haven't looked back since. It's a wonderful place to live. It's a wonderful place to practice, and it's allowed me to practice dentistry by building connections, by having the time to build connections with my patients and really get to know them and get to understand what they need, and then get to deliver on that and give them great outcomes in a beautifully comfortable environment.
When we created the clinic and how we wanted the practice to look and feel, we've got our values that we live by, and it's very much about being a welcoming place where everyone feels welcome, nobody feels judged. So we've designed it that way. So when you come into our practice, you go into a patient lounge. There's couches, there's plants, there's beautiful artwork. I'm obsessed with beautiful artwork. I want you to feel like you're sitting in a place where you are comfortable before you go onto the next stage of your journey with one of the practitioners. There's no dental blue, there's no teeth photos. You just feel like you're in somebody's lounge. You hear that beautiful girls will greet you with a smile at the door. They'll say your name, you'll sit down, you'll feel comfortable. That's how we create our space.
Okay, let's try that again. Big smile, teeth together. Oh, that's better. Okay. From my perspective, I'd already had 10 years of experience working as a dentist. So for me, technically, I could do all the technical, but this was our chance to really shape the feelings that people would experience when they came to see us, which is completely different from the technical side of things, and which is something that 99% of dentists do not think about because they're so focused on getting the technical stuff right, they don't really factor in the way the patient will feel as they're having their treatments done. So we started with a whole clean sheet, and we just said, we know we've got the technical worked out, let's focus and let's create the patient experience and take it from there. So I'm the anti-dentist dentist. I want people to walk in and feel calm, not scared. Dentists are typically very technical people, and often when you're very technical, you can be less empathetic and less emotional, less in tune with people's emotional needs. And when you're investing so much time and effort into your treatment, you want to feel as though you're really being cared and looked after. And that's what we do. My job is to make sure that nobody walks out hurt, neither emotionally nor physically. I want to remove fear from dentistry because nobody should feel anxious or scared in a space meant for care.
I'm Richard Porter. I'm Johnny Smith. And this is Smith and Sniff, a podcast in which two friends talk about cars and many other things live in Derby.
I'm always amazed at how calm he is in the surgery, because he's in the zone and he goes about and he does his thing. He does it with elegance. He's just there and doing it, because sometimes he'll come out and he goes, wow, that was way harder than I thought, but you would never know. The patient doesn't know, the DAs don't know, because he's just in the zone and he's doing his thing. Whether it's Lego or a crown, he just disappears into the flow. Before we even bought a practice, one of the walls in our house was covered in paper, and we were mapping out what we actually wanted our practice to look like, what we wanted the patient experience to look like. All of these things were really important. Finding a practice was more about our location where we were going to do that, but we were all about the customer experience and how we're going to shape that, because, you know, from Anand's experience in the UK and what he wasn't able to do, this was our opportunity to shape it from start to finish in how we wanted the patients to experience dentistry. And we were really at the start about how can we change the way people think about dentistry.
You can just wheel yourself.
Yes.
Oh, okay. Let's go this way, Billy. Now this one. Now you stick them together. Other hand. That's it. Now this one. I remember I spent a lot of my childhood building things. Lego was my favourite toy, and that served me well in kind of preparing me for this role and preparing me for my career as a dentist. I was always tinkering with something, building something, taking it apart. One more? Oh, good job. Thank you, Pudding. High five. Yeah, good boy. My passion outside of teeth is carpentry and woodworking. Like when young girls dream of their fairy tale wedding, I dreamt of my fairy tale bookcase with a rolling ladder, and I knew that at some point I always wanted to build one. And when we moved into this house, these beautiful stone walls, this was a perfect spot for the library. And this is, you know, the results of 6 months of hard work. So we have the continuous grain where the grain flows seamlessly across the drawer fronts. And then when we open up the drawer, these are all push to open drawers that's topped with solid hardwood. We've also got these beautiful walnut dowels. If you can do it yourself, you've just got such a sense of accomplishment and pride having created something. This is the culmination of 6 months of hard work, long hours in the shed. And so I created this and built this. I got into dentistry because I wanted to do something where I was working with my hands and doing something. For me, I can't sit at a desk tapping on a computer all day. And the mouth I find quite interesting because it is like carpentry on a micro scale. And this just allows me to make a living off woodwork, but in a completely, you know, it's the same but different. So we started off in the UK, where I grew up in London, and then I went to university in Leeds up at the top, and then I spent most of my time in the Midlands before I moved out to Australia. I was in Swan Hill, represented by the Murray cod, and then moved down to Warragul, where we've got Bruce and Dave representing Warragul. Belinda and I got married in Cradle Mountain in Tasmania, which is what these rings represent. We went on honeymoon to New Zealand, and we've got an image of the Wanaka tree, which is one of the stops on our trip around the South Island in New Zealand.
We met online actually. Anand was based in Swan Hill, which is where he first arrived. I was in Melbourne at the time. His profile said he was in Melbourne. Yeah, it was pretty quick after that. He'd come down to Melbourne, and then I came down to Swan Hill. Then we pretty much lived in each other's pockets every weekend since.
I love Melbourne and I love to go there to visit, but I think at heart I'm a country guy. I like having a big shed. I like that there's no traffic. I like that I can walk down the street and bump into people that I know. The people here are fantastic. The community is beautiful and really welcoming and engaging. And Australia is a beautiful, warm, inviting place to live.
It was early on when we met, we were already talking about how we want to shape a business together and how passionate he was about it. And I think that's Warragul is a real home and a community, and that's why we've really linked ourselves here, because it's not so big that you can't be part of the community and know people and engage with people. So that's what's really helped us find our home here.
Warragul Dental Care have changed people's approach and willingness to go to the dentist. At the same time, there's more practical applications, like they've introduced technology to minimise downtime for some of their customers. Because a lot of their customers in this particular area are farmers. A trip into the dentist is not a half hour out of their day, it's a whole lost day. By being able to consolidate that into one day, it makes a huge impact on their customers. The Gippsland Business Awards were created almost 30 years ago now to celebrate and recognise excellence in business across Gippsland.
Warragul Dental Care boasts 8 beautifully renovated treatment rooms, 3 private consultation rooms, photo studio, and Australia's first certified dental therapy dog, Dr. Bruce.
To see a business like this enter the Business Awards, go through the selection process, and then not only win their category, but win the Business of the Earth is such a tremendous feeling. They've obviously put a lot of work and effort into their business over time, and to see them be recognised by their peers and acknowledged for the great work they do is fantastic for them and for the Business Awards, because we know that we're celebrating people who've put so much back into their business and ultimately the community.
I've been doing this for a long time, and what I love actually now is being able to mentor my colleagues and mentor younger dentists to help them fast track their excellence.
He always thinks about other people, and always wants to make people laugh and smile. And what better way than going into dentistry and make people smile better?
I'm really proud of what we've achieved. To think we've come this far and done all these things, it's really humbling. I feel myself getting emotional. Sorry.
They're not just providing a service, they're changing what healthcare looks like across our whole region and lifting the bar, which hopefully encourages others to lift the bar and provide excellent services in a regional setting.
Come, up you go. Good job. Warragul Dental Care, in association with Canine Synergy, made history without even knowing it, with Bruce being the first ever dental therapy dog in Australia. And now other clinics are following that lead.